Hi, everybody. This is Dr. Ladd McNamara. Have you heard something lately about the vitamin D? There's a vitamin D study that came out recently. It was done at Brigham and Women's Hospital in Boston, which is essentially Harvard. And this came out, and a lot of people have been concerned about vitamin D ever since. And some people, the sky is falling because vitamin D is going to kill us now, right? Well, really what the headlines has been vitamin D not beneficial. You've been seeing things all, wherever you turn on the news anywhere, both in the medical journals as well as the lay publications, and such things as, we were wrong about vitamin D all along about whether it was beneficial. In other words, these are really sensational headlines about vitamin D. What does it say? Most should stop vitamin D supplements. I mean, really? Come on. We should stop them now because of this study is the end-all be-all to vitamin D is not beneficial. Think about this. There's been tons of studies lately, recently, about vitamin D and other supplements not being beneficial and that people just don't need them. Why the big push? You gotta really wonder that with the supplements that don't cause any harm to anybody truly. I mean, there are some possible side effects to supplements, but the point is, if you look over the last 10 years from the CDC Poison Control Center, there's 0 deaths from nutritional supplements. So that's the big thing. But yet we still hear that vitamin D now may possibly be harmful. So that's the concern, and it just. And we've been seeing over the last few decades, there's been some conflicting studies about the benefits of vitamin D. A lot of studies shown that it's very beneficial, and other studies that it's not shown benefits. So the question is vitamin D helpful? Is it beneficial? Should we be taking it? Well, you kind of already know my answer to it, but let's review this study a little bit so we can understand it. This recent study that came out recently. It was published online in the New England Journal of Medicine. So the online version of that, it says this is a Harvard study, a Brigham and Women's Hospital. It's called the VITAL study, VITAL. That's kind of a vitamin D. They kind of dug out the letters out of that. The VITAL study. It was a 5.3 years long study. So it wasn't that long. It was long, but not that long. When you consider how long does it take to develop heart disease, 5.3 years is not a long time. Well, they randomized, it was a placebo-controlled study, randomized. In other words, this is the gold standard of studies. And they had a good sampling of people, over 25,800 people, of men and women, and they were over the age of 50. Now, these were generally considered healthy people. They weren't people with heart disease, known cancers, or anything like that. What they did is to these groups, they had 4 groups. They had a group that received vitamin D at 2,000 IUs per day, plus receiving a placebo, as well as a fish oil group, or omega-3 fatty acid group, that were receiving 1,000 milligrams of omega-3 fatty acids plus a placebo. Another group that received vitamin D at 2,000 IUs and the fish oil, or the omega-3 fatty acids, and a placebo group. Each were taking basically two capsules or pills per day. And they didn't know what they were taking, but this is how it effectively came out. Well, what they found after 5.3 years, in the omega-3 fatty acids group, they found that of those, some people developed heart attacks in both groups, the placebo group, the vitamin D group, and the omega-3 fatty acid group. They found that there's a 28% decreased risk of heart attacks in the omega-3 fatty acid group compared to the placebo group. That's pretty good. I mean, when you consider that you're taking your high-quality fish oil supplement, that you're doing pretty well, and you are. And it has many benefits beyond the heart. But that was the one thing. And actually, interestingly enough, it showed there was a more, blacks received more benefits in that group. In other words, there was a higher percentage of blacks or African Americans that received a benefit, in other words, a decrease of risk of heart attacks than whites or other groups. Well, that also showed in the vitamin D group, it showed a 25% decrease in cancer deaths from people who developed cancers during the study. Now, these people didn't know they had cancers, any cancers growing when they entered the study, but obviously people over 5.5 years, of people over 50, some people will develop cancer. Of the people in the vitamin D group that develop cancer, 25% decrease in risk of cancer death. Oh, but we should stop our vitamin D because it doesn't have any benefits, right? That's what they say, because that's what you've heard, because that's what they want you to know. So anyway, as far as the vitamin D group in regard to heart disease or heart attacks, it showed no difference in the heart attacks or deaths from heart disease or cardiovascular disease, a heart attack, compared to this placebo group. So here's the conclusion of what they come up with is why vitamin D is not helpful, not beneficial. As a matter of fact, the conclusion was to stop your vitamin D. Well, at least other people's conclusion was, maybe not the authors of the study, but this is what I've been reading, to stop your vitamin D. And as a matter of fact, if you're considering starting supplements, don't even start them. Just don't do it, because there are plenty of drugs to go around the pharmaceutical companies want you to be on. So that is a waste of money. Those are the things. It's just absolutely ludicrous. So let's look at the things. What did the study tell us in regard to heart disease and vitamin D? Well, we know it had a 25% decrease in deaths from people who developed cancer. But here's the thing. The vitamin D was given at a dose of 2,000 IUs per day. That's what they call a high dose. Well, when you compare it to 400 IUs, which is found in most multivitamins, then 2,000 IUs is higher compared to that. I don't consider 2,000 IUs per day a high dose at all. I consider that a foundational dose. That's the dose that's in your high quality vitamins antioxidant supplement. So I don't consider high. Plus the study was 5.3 years long. Well, granted, some people with in other words, the omega-3 fatty acid group showed a decrease in heart attacks as compared to placebo, but not in the vitamin D study. But what if they carried out the study for longer than 5.3 years? What if they conducted it for 10 or for 20 years? Would they have seen benefits and decreased risk of heart attacks and deaths? Maybe, maybe not. You can't say. All that we can say is that 2,000 IUs per day does not, vitamin D does not decrease the risk of heart attacks compared to placebo in a 5.3 year period. That's the conclusion. It says nothing about it, because there have been many studies over the years that have shown that there's a decrease in associated decreased risk in heart attacks and deaths from cardiovascular disease when taking vitamin D. And there are many other benefits as well. So it really comes down to the blood level. What blood level of vitamin D is obtained from taking 2,000 IUs per day? In other words, when you do your blood level test, you have it's called a 25 hydroxy. That OH means hydroxy. 25 hydroxy vitamin D level. That's how your vitamin D is measured in your blood. You should probably have it twice a year, spring and fall. Now, normal is considered 20 to 50 nanograms per mil. Many doctors suggest maybe about 40 nanograms per mil. If you go lower than 20 nanograms per mil, then you will run an increased risk of rickets and osteoporosis and things like that. Well, what about if you go over 50 nanograms per mil, which is what I encourage people to do, significantly so? Well, 2,000 IUs per day will probably get you in that range. What I've seen from my research is that when you get a vitamin D level in the range of 65 to 85 nanograms per mil, there's an associated decreased risk of cancer. There's an associated decreased risk of heart disease. The association is there. So the study that used only 2,000 IUs per day, I guarantee you those people did not have blood levels at 65 to 85 nanograms per mil, the levels that works. In other words, if you're going to do an assessment on whether something's effective or not, let's take antibiotics, for example. Do antibiotics kill infections? Does it stop the infection in your body? Yes, they work. But what if you take a substandard dosing of antibiotics? Well, it will work a little bit, but not much. What if you take even less than that? What if you take a half or quarter of the standard dose? No, it's not going to be effective. And then the conclusion would be is that antibiotics don't work, and you shouldn't use it, and it could be possibly harmful because the the bacteria's fought back a little bit, but then you get a resistant strain, and then it can kill you with the resistant strain. So therefore, the conclusion would be antibiotics can be harmful. Well, it's not exactly what happened with the vitamin D, but when you're talking about using a substandard dose to reach substandard levels of vitamin D, or suboptimal, let's put it that way, suboptimal levels of vitamin D, then you're going to have a big issue, and you're going to conclude, as the study did, that 2,000 IUs a day did not reduce the risk of heart disease, so therefore it's useless. Well, what about toxicity? Vitamin D toxicity doesn't occur till you're over 150 nanograms per mil, which is in other countries like Australia and New Zealand, they'll use levels of nanomoles per liter, which is so 150 nanograms per mil, which is we use here in the US, and I'm not sure about Canada. Sometimes they use same as we do, sometimes they don't, but it's 375 nanomoles per liter. Well, usually what happens when you get above those levels, the first thing would be is like arrhythmias, heart arrhythmias. So then you'd back down the dose if you got that level. But nobody has gotten arrhythmia from vitamin D at levels below 100 or definitely below 150. Is there a concern for high blood calcium levels? No. There's been no high blood calcium levels seen with levels that are below 100 nanograms per mil. It doesn't happen. And again, you have to get over 150 nanograms per mil to do that. So what about the dosing? So this is general. Everybody's different. The absorption is different. And the amount of sun exposure is different. But in general, as a rule of thumb, 2,000 IUs per day would get a person and sustain their blood levels, vitamin D blood levels between 35 and 40, maybe 45 at most nanograms per mil. Most people don't get up to that 40, 45 with 2,000 IUs. Usually they're down to 30 to 35. If you're taking about 6,000 IUs per day, so that's if you take your foundational vitamin antioxidant tablet, plus you take, let's say, additional vitamin D, 4,000 IUs additionally, then you're going to get your blood level close to 60 to 75. Some people will still be at a level of 50. So again, you don't know because everybody's individually absorbs it differently and has a different exposure to the sun, etc. So you have to give your blood level check to see. And if you're taking 10,000 IUs per day, then you're going to get your blood levels, or have a good chance of getting your blood levels up to 80 to 100 nanograms per mil. Sorry, I messed that up there. So for example, I take 12,000 IUs per day, 12,000. And I get my blood levels around 90 to 92 IUs per day. All right, so that's just a general rule of thumb. So let's go back to that vital study. The vital study, they used 2,000 IUs of vitamin D per day. And so maybe the people had at best had a blood level between 35 and 40 nanograms per mil. That level did not appear to reduce heart attacks over the course of 5.3 years. That's it. You can't say anything beyond that. To say it's useless, to say it doesn't help reduce the risk of heart disease is not correct. It does not show to reduce the risk of heart attacks in 5.3 years, the dose of 2,000. That's what they proved. They proved that for sure. So what about, though, if the study had given people a dose of 6,000 to 8,000 IUs per day and had a blood level of 60 to 80 to 85 nanograms per mil? What if they had that? Would the results have been different? I think so. I don't know, but I think so. And so when you have a vitamin antioxidant tablet of 2,000 IUs per day, then you take additional vitamin D. I'd suggest you consider that. Consider that. 2,000 to 4,000, so you get 8,000. Is that too much? I already showed you that it was not too much. Plus you can get your blood level to make sure you don't go over 100 nanograms per mil, and definitely not over 150. But the thing you're getting, in addition to taking your vitamin antioxidants, you're getting other micronutrients that have been shown to be beneficial to your whole body and your whole system. The synergy of that has not been tested. You see, the individual micronutrients are tested, or this vitamin D with omega-3 fatty acid was examined or studied, but what about the others? That makes a huge difference. That's our message about the synergy of it. We know that vitamin D deficiency is associated with every single chronic disease, from heart attacks to heart disease, the deficiency of vitamin D. The deficiency of vitamin D is associated with cancers of all types, dementia, Alzheimer's disease, autoimmune diseases, asthma, pregnancy complications, on and on and on. And diabetes, you can go on and on about the deficiency of vitamin D. As a matter of fact, I do have an article that I wrote on that, and it's free. You can go, this is the website, you go to drladdvip.com/vitamin D3. Doesn't matter whether you capitalize the D or not. It's drladdvip.com/vitamin D3. I have my article there on vitamin D and many of the things that I've said. I did not put this recent study into that article. I'm going to do that this weekend. But the rest of the information that I have shared with you is there, including the dosage, the benefits, the toxicity, etc. of vitamin D, including, I would talk about in that article, that vitamin D helps decrease insulin resistance. When you get blood levels from 50 to 70 nanograms per mil, you're going to decrease the insulin resistance. Insulin resistance is a step towards type 2 diabetes. This helps with, and then when you put it in with the other micronutrients, imagine the benefits. That's why during my years of practicing medicine and beyond, after I retired from the practice of medicine, and talking with groups around the world, I've been able to see the people who've been able to stabilize normal blood pressure, or blood glucose levels, blood pressure as well, but blood glucose levels. In that article I gave you the link to, and I'll put it in the comment section after as well, that vitamin D at 65 to 75 nanograms per milliliter is associated with the decreased risk of many types of cancers, from breast cancer, colon cancer, prostate cancer, ovarian cancer, etc. There's multiple myeloma, etc. They are associated with it. When you get the blood levels at that level, and it makes sense because, as we talked about already, that study showed that 2,000 IUs of vitamin per day reduce the risk of death. Reduce the risk of death by 25% compared to the placebo. Also, in my study that I gave you the link to, vitamin D in children, it reduces the risk of respiratory infections. In other words, this one study looked at children who had multiple recurrent respiratory infections. And kids get exposed to a lot of garbage at school all the time, so they're getting sick quite frequently. So they took a group of kids who had frequent recurrent respiratory infections, and they gave them weekly injections of vitamin D at the dose of 60,000 IUs per week. That comes out on average to about 8,500 IUs per day. For a child, now remember, some people are nervous about taking 8,000 IUs per day as an adult. You shouldn't be. So the children were getting this. And they found in this study, how much did it reduce the recurrent respiratory infections? Over the course of 6 months of doing this, not one child in the study, not one, who had previous recurrent infections over the previous year, several, not one got a respiratory infection. It's impressive. Well, what other respiratory infections could you think of that is seasonal, that people get really, really sick? The flu? Well, because vitamin D has an effect of reducing pro-inflammatory cytokines, which is associated with what happens before a flu occurs, and it increases the antimicrobial proteins. Antimicrobial proteins. Now, just decipher this. It increases the bacteria and virus killing effect. That's what that means. Vitamin D increases your immune system's mechanism to kill bacteria and viruses. That's what it means. And that's why many people are seeing that vitamin D can be more effective than a flu shot, much more effective than a flu shot in helping to prevent vitamin D. Now, anything I have to say is not meant to treat, cure, prevent, diagnose, mitigate any diseases, and what other part of the disclaimer? And talk to your doctor about before you do anything, right? Right. So, the vitamin D, those with heart disease, known heart disease, will benefit by taking vitamin D and keeping their blood levels above 50 nanograms per milliliter. Nanograms per mil, yes. I suggest you keep it close to 75 nanograms per mil because you're going to benefit from it. And the study that shows that, the fact that there's a decrease of cardiovascular deaths when you have a level that's above that by 30%, So the conclusion that you've been hearing in the news, that the study laid to rest the benefit of vitamin D, is not true. All it did was say that 2,000 IU's per day of vitamin D does not decrease the risk of a heart attack or deaths from heart attack in a 5.3-year period. That's it. So with that news and armed with that knowledge, and check out that article, that free article that I gave you the link to, you are ready to go and talk to other people about it and disarm the naysayers about it. So again, knowledge is key. All right. Have a good week. Friday, it's Finish Strong Friday. So I want you to finish strong, take your supplements, talk to other people, share with other people the importance of nutritional supplement, of quality nutritional supplements with the quality raw ingredients. Quality manufacturing equals the results that you want. Take care, everyone. Thanks. Bye-bye.